My dream to have my own health center that was nurse-led. I met with the Abbotsford Homes Tenant Management Corporation, led by Dorothy Harrell, thinking I was going to get shot down, and what they were going to say is, why are you offering us nurses? You always give us the short end of the stick. Why not physicians? To my surprise, Dorothy Harrell looked at me and looked at her colleagues and very, very slowly said, in my estimation and in my experience, it is nurses who do the caring, and this community needs caring. So that was the beginning.
In this time of economic uncertainty in America, we become aware of more and more disenfranchised people who have had and lost insurance.
We're a federally qualified health center, so we are providing services to some people that really come from what we consider underserved communities. There are really no hospital systems down here, and for many...
I have spoken in statewide conferences and national conferences, and when people find out that we have this integrative therapies, dental, primary care, behavioral health, legal, medical, and mind-body all in one location, it just blows their mind. They're not used to that, and it's a very,
to the best of our ability. We need to be able to be there under any circumstances for all of our patients, regardless of their ability to pay, so that their overall health will improve as the health of the community improves at the same time.
So one of the great things about working for FPCN is that it really has a family atmosphere. We work as a team together. And it's more about helping the patient and getting to an answer and delivering quality patient care and making that accessible to everyone. We have social work, we have nurses, we have nurse practitioners. We're really here for the patients, and that was...
Community engagement for me reaches far beyond the walls of medical facility or health center. It's knowing the nuances of that community, and of course, the patients that we serve make up that community. So we need to know who they are. We need to know their values. And you get that by community engagement, by not just limiting our contact with them to their physical visits. It's one thing to want to know, how much weight a patient gained or how they're doing with their dietary habits, how's their blood pressure. But it's also important to know what's going on outside in their lives and their families, and what's important to them and what their stresses are and what their concerns are. So when you do that in a way that lets people understand that you're really concerned about them, they're a patient, but they're not just a number, and you really
When I came here, I was in a wreck. I had problems drinking, problems with drugs, depression, hearing voices, seeing a psychiatrist, and everything. They helped me with everything that I needed, and they never refused me. It's never too late. There's a light at the end of the tunnel, and I'm 63. It took me 50 years to get through there, and I made it. And I didn't make it by myself. I made it through the health annex. Everything's cool.
I have always been interested in working in a place where the staff looked like the community that we serve. Coming to FPCN really has opened my eyes to some of the lack of access that people experience. It is my pleasure as the nutrition educator and also as a registered nurse to help patients manage their chronic illnesses. And so one of the ways that I get to do that is through our diabetes education classes, our pre-diabetes education classes. But then
FPCN is a trauma-informed care community, and what that means is that we assume that everyone, whether it's patients or staff, has been through some sort of trauma. And we take very seriously self-care. As a part of that, I get to see staff on a one-on-one basis, whether it's getting a massage, doing a little meditation, or just airing out their grievances and just venting. And also, I offer group sessions with the various departments here. So once a month, we have fun. We do team building and have lots of laughter. It's important to take care of ourselves. If we don't take care of ourselves, how do we take care of our patients? So we really, really are trying to get people to understand how important self-care is.
We're a values-driven organization. We embrace diversity, we embrace quality care, and we will embrace you.